Good evening, all. Welcome, everyone. Sorry for the late, delay, because there was a technical issue for the chief guest. Uh, Thank you all for joining us for today's webinar. Myself, Dr. Srijit, and I'm the product manager of Vaidyaratnam Aushashala. Vaidyaratnam is the leading health provider and manufacturers of Ayurveda. Our mission and vision are to promote classical Ayurveda. So we decided to conduct a webinar series on clinical approaches towards dermatology, rheumatology, and respiratory disease in relation to winter season. So it's my pleasure to welcome you all to this first session on the topic clinical approaches towards skin diseases with special reference to winter season. On behalf of Vaidyaratnam Aushashala, actually, I would like to welcome our chief guest, Professor Sanjeev Sharma. He will join later. So I welcome sir for this session. So I would like to inaugurate. On behalf of Sanjeev sir, I will. He will join later to the session, and please cooperate. And the now I would like to invite our today's presenter, Dr. Ashwati S. Uh, she completed her BMS degree from Rajiv Gandhi University of Health Sciences, Bangalore, and post-graduation in Agatantra from Government Ayurveda College, Trivandrum. Madam took fellowship in medical cosmetology under Griswald University, Germany in 2019, worked as assistant professor at Mannam Ayurveda Medical College, Pandalam. Madam is presently working as a specialist medical officer at Government Ayurveda Hospital, Trivandrum. I welcome you, Madam, for this session. Dear doctors, I would
Thank you.
like to welcome Dr. Aravind S. to moderate this session. Sar completed his BMS from Vishnu Ayurveda College, Kerala, and completed his post-graduation from VPSV Ayurveda College, Kottakkal. Sir worked as assistant professor in Ayurveda College, Coimbatore, later as associate professor and HOD in the same institution. Sir is presently working as assistant professor in the Department of Agatha Tantra at Vaidyaratnam Ayurveda College, Thrissur. I welcome you, sir, and please take over the scientific session. Welcome you, madam, and sir, for the scientific session. Thank you.
Good evening, everybody. So, as explained in the introduction, this is a part of the first webinar series in the name of E-Vishrutha, organized by Vaidyaratnam. And today's topic is skin diseases in winter season. What all are the in the coming few hours we will discuss about the what all are the general skin diseases that can happen in the cold season or winter season. And this session will be dealing by the Dr. Ashwati S. And afterwards we will have a discussion regarding these sessions, and there will be a question and answer session, and likewise it is planned. And we will start the session anyhow. Over to you, madam, please.
Thank you. I'll share the screen now. Is it visible now?
Yes, madam, please.
Okay. Okay, shall we start now? So, first I thank Vaidyaratnam Aushadashala for giving me this opportunity to present the diseases that comes under winter season. And I wish all the success for your this program, E-Vishrutha. And we'll start the that session now. So my topic is skin disease of winter season. You know, Okay. So first, we will see what is winter season. Actually, we know winter is the coldest season of the year, which comes between the autumn and spring.
Madam,
Oh,
can I?
ah,
Okay. Actually speaking, our inaugurating sir is
okay,
busy little now, so
okay.
he has told that he will send us some message to us, and can we start with that
Yes,
before
yes.
starting the main session?
Yeah, of course.
Okay, okay, okay. Thank you.
Shall we stop the sharing now?
Yes, yes, madam, please.
Thank you, sir. We are grateful to uh, him for accepting our invitation in this busy schedule and becoming a part of this academic session. I welcome you, sir, and thank you for inaugurating this session. Over to you, sir and madam. Please continue.
Okay, madam, now we can continue.
Okay. Okay, we'll start from the beginning. That is, we are talking about the winter season. You know, winter season is the coldest season of the year that comes between the autumn and spring. And the word winter, that's a German word, and it's mean the time of water. That means the rainy season or the snow.
Excuse,
That
madam, can
oh
you please
yes.
check whether it is shared or not, the slides?
Oh, you. I'm sorry.
Okay.
Okay, no visible, no.
Yes, yes.
Okay, so that's a word meaning. That's a winter. That is a time of water. It refers to as a rain or snow. Okay, so we know it's a coldest season. And what is told in our Shastra, Ayurveda, we know there's a six ritus, and Acharyas explain Ritucharya very clearly, and what should follow, what are the diet, what are the viharas, what are the aharas, and whatever the things we have to do. He explained very well in our Ritucharya. So the winter season that comes under two ritus, that Hemanta Ritu and Shishira Ritu. You know, we have two kalas, Adana Kala and Visarga Kala. Actually, Hemanta Ritu, that is comes under this Visarga Kala, and Shishira Ritu, that comes in Adana Kala. And what is told in Hemanta Ritu, that's Belina, we are so healthy, and it is because of the Shida Samrodha, because of the cold from the outside, our Agni, it will be very prabala, and so our appetite will be so strong, our Agni will be so strong, and because of that, may uh, do the Dhatu Pachana. That's why we have to make use of Swadu Amla Lavana Rasas. Okay. And he's telling that in the Dairghya of the night will be more, and the person should be very hungry during this season. And that's why we have to eat what are the things he's told in the diet. First, like we have to go for Godhuma, we have to take Guda, Achasura, Ikshu, Kshira Vikriti, all the things he has told. And he's telling that because of the cold of outside, there will be more Vada. Because of that, our skin becomes so dry. And that's why we should use Vadakna, that's Tailas, for the Bhinga, for the massage. You just hear what I'm saying now, and afterwards, when we are going through the disease, you will understand what is the significance. He's telling all those things in the Ritucharya, okay? And he's telling Murtha Tailam, we should apply oil over the hair, and Vimardhanam, we can go for the massages, and especially he's telling we should do Padaghadam with a Kushala, who's experienced one should do the foot massages, okay? And he's telling after the abhinga, one can use kashaya rasa dravyas for that removing the oil from the body. That's for the mild udvartana. You can use kashaya rasa dravyas. And he's telling after that one should apply kunguma, should apply kunguma for preventing the water loss from the body. And after that, he should do agaru dhupana, little mild svedana also one can do, because to make the body little warm. And he is telling all the diets what I told just before, and he is telling shauchakare sukhodagam, one should use ushnodaka, like sukhoshna jala for the that shauchakarya, and all for the bath and for other things he should use. And he's telling we should use because the silk or blankets, some to prevent the that cold, that we have to use that guru pravaranam and etc. we have to use. And he's telling the Shishirudu, I am eva vidikarim, same that of Hemanta Ritucharya, you should go for the Shishirudu also. And he's telling Shida Madhikam, because in the Shishirudu there will be more Shida. This comes to Adana Kala. So it takes off more Bela from the body. So we have to use more, we have to make our body so warm than Hemanta Ritu. And the main, just keep all those things in your mind, and I will say what's the importance of that. And the main diseases that comes under this winter season, that's dry skin, chapping of the lids, atopic dermatitis that get worsens, psoriasis get worsens in this, vipatika also get worsens in this condition, shita pitta, that's called urticaria, and darunaga, like dandruff, like things in your head, and like some fungal infections. So first, we will go through the first one, that is the dry skin. And it is clinically it is calling as cirrhosis. It's a medical term. It's a dryness of the skin. The skin becomes so itchy, red, and rough skin. Okay, and sometimes while itching, the skin become crack, and sometimes the peeling of the skin can see. And in the winter dry skin, you can see flaking of the skin, rough patches, cracks, redness, itching, stinging, like changes because of this exposure to cold weather. We know our skin have a barrier and which holds the water content in the body, and because of this cold things, some derangement of the metabolism and the water loss is coming there, and we are facing into the dry skins. And the next conditions of the dry skin is ichthyosis. Ichthyosis, we know it's a genetic condition. Somebody can be there by birth, or after because of some diseases, one can acquire this ichthyosis, the extreme dryness of the skin. Okay, and some that symptoms are extreme dryness of the skin, thickening of the area, thick flaking can be done. More we can see on below the knee joint. We can call it as xeroderma conditions. And two types, inherited ichthyosis and acquired. Inherited from the by birth, acquired because of after some of the diseases. And it is sometimes autosomal recessive and autosomal dominant. If our grandfather having ichthyosis, maybe his son may suffer from ichthyosis, but may not be his grandson. After the second generation, again this ichthyosis can come. That's a gene that mediated ichthyosis. And acquired because of some diseases like leprosy, hypothyroidism, lymphoma, psychosis, some HIV like infections can cause the acquired type of ichthyosis. And you can see like this, the peeling and crack type of the skin you can see. And diagnosis by the this for the lesions one can see. And if not some, if you are doubted with the dry skin or xeroderma, you can go for the biopsy or DNA study, and parental like amniocentesis study can also reveal. And for the inherited type of ichthyosis, not much effective treatment, but we can go for the acne correction of the patient, and especially we can make him sneha nitya, like vijarana snehapana. If his acne is corrected, we can go with vidaryadi gridam or bharita gridam or tikta gridam internally. And at the same time we can go externally with abhyanga and some mild uddardvana to fall off, to remove the scrubs. But we should be very careful because the skin, no, that's because of flaky skins are coming, there's a chance of getting infection between the skin layers. And sometimes some bad odor also can cause because of the infection. In such infections, we should not go for Maidudvartana. That time it's a acquired type. That time we can go with the Tribhala Kashaya Kshalana or Seka. You can do And if there is infection, you can give Gopi Chandana Gulika or Gugula Panchapala Churnam to stop the infection. And after that, if the acne is correct, and after his metabolism correction, you can go for the Vicharana Snehapanas. And Mashadi Churna, if everything is okay, for removing the that dry skin, you can go with Mashadi Churnam. It's available for Vaidyaratnam. And you can make this mashadi churnam, you can cook with rice water and make it as a paste form and apply over the area, and you can just mild scrub to remove the skin. After that, you can go with any oil application, especially like eladi keram, you can use. And while coming to the American Association of Dermatology, they are telling what are the regimen, what are the things we have to do in winter season to prevent the this type of that dryness of the skin in normally for the normal skin person, or in the case of ichthyosis. What should we do? We should do we have to use any protective moisture, and you can one for the exfoliating scrubs of face mask. The same thing our acharyas are telling. We have to go for as a protective moisturizer. We are using acharya is telling you have to go for taila, like taila bhingam, an exfoliative scrub. He's telling kashaya rasadravyas should use for the exfoliation. He's telling like that. What are the kashaya rasadravyas? You can use like khadira. It's a kashaya rasadravya, which is good for the skin condition. Another one is haritaki, vibhidaki. So you can use triphala for the exfoliating purpose. You can use this mashadi churnam. You can use the siddharthagadi sana churnam for the exfoliation purpose. And what he is telling, drinking plenty of water. Yes, you should. Surely one should drink more water, because in winter season we won't feel much thirsty. Then also at least 8 glasses of water you should drink. And he's telling one should take omega 3 or omega 6 fatty acids, which is easily available in that from the that diet, mm, mm, like milk and milk products. You will get this, and from some fish oils or some sort of non-veg foods. Same our acharya is telling. He is telling one should take shira vigrati, one should take navannam, one should take guda, one should take ikshurasa, full of nutrients, full of that's whatever the things we need. Actually from the diet he's telling, he's telling mamsrasa you should take these things. Surely we are getting from the that diet who is telling by acharyas in Hemanta Rutu and Shishira Rutu. And he is telling using a less that exposure to heat. He's telling arka sevana one can done, but by yukti, according to that condition only you should do. And they are telling you one should use the protective warm clothing. Same our acharya is also telling we should do the guru pravarana, because of the skin like silk things we have to do. And he's telling that limiting exposure to heat, but some steam one can do, mild steam. So he's telling after that agru dhupana one should do. Okay, so how clearly and how beautifully our acharya is telling the Ridhucharya, that is Hemanta Ridhu or Shishir Ridhucharya, according to the winter season regimen. And we can see we can follow the things to make our skin so healthy in winter season. And like abhinga we can do, you can use eladi kera tailam, dhanvandaran tailam, jivandyadiyamagam, pinda tailam, etc. for the abhinga, for the massaging purpose, so as to prevent the water loss. You can moisturize your skin by this. And mild udvarthana, as I told before, siddhartha snana churnam, meladi churnam, triphaladi churnam, and mild svedana, actually he told, and sukhoshna snana, shaujakare sukhodam, he's telling eladi cream. And one thing you should keep in your mind, that who is getting that like dry skin, the extreme use of soap and soap liquids, that is one should control the use, because it again evaporate the that water content from your skin. So they can if any glycerin content soap, or you can use neem leaves. You should make a paste with coconut milk, and that paste, if you are using for the snana purpose, it's very clear, it's very useful to prevent the dry skin, or to prevent the cracking of the skin easily. And also pinyaga, you will get the fresh pinyaga, that is after extracting the oil, like from the oil shop. You will get that pinyaga you can take, and you can mix with some water, make it a paste 15 minutes before your bath. And that one you can use externally. It's a good scrub also, and it moisturizes your skin also. and like padha leaf, cyclia peltata. That just you make the paste of padha leaf and keep it in water for 10 minutes, you can see that the leaf become jelly form. That much, that hygroscopic action the padha leaf is having. So you can use that for the external application. It will, as a like how a moisturizer retains water content in your body, the same way the application of padha leaf can help to hold the water content in the skin layers and make the skin that prevent the skin from the that damage. And three types of moisturizing are there. One, emollients, that is helps to rebuild the lost lipids from the skin, and it will be oil based things. And humectants, that extract the moisture from the outside environment and help your skin, like to make the skin prevent the water loss from your skin. And it will be glycerol or lactic acid base. And the third one is occlusive. Then it acts as a physical barrier. It will be thick application of the paste and prevent the water loss from our body. So the things what our acharyas explained as the taila, as the scrub, as the dhupana, whatever he is telling, while using these things, you can prevent the water loss from your body and make the skin little bit oily and healthy. So next, and one thing, if you're going outside, if it is very difficult to take off these oil content creams or these oil applications too, outside, you can do a simple things like you can take the japa, like a hibiscus flower, and you can boil it. And after that, you can add like some rose petals to it, or some rose water, and strain it. And you can use in a bottle, and for spraying like sponging etc, you can done that in many times in a day when you are going out. Okay, when you are getting exposure to the outside, you can use as that as a moisturizer. And the tulasi, just you make paste of tulasi with water in a mixture. Just you have to crush it, and you have strain it, add with honey, and that one also you can externally application before on the time of your that bath as a pack you can use. And virgin coconut oil, it helps to uh, that water loss from your body. And also, if merely tilataila also one can apply, because as it contains much amount of vitamin E, it makes the skin healthy and prevent the body from the that water loss. And if thilarila is not available, you can use butter or ghee, because it contains rich vitamin A and the retinoids, that it helps the collagens to be so healthy and form. So you can use Tiktagridam or Shatadavdagridam external application while you are going out or any times in your home for the to prevent the water loss. And next comes the chopping of the lips. That's the same thing, like a vermilion border for our lips. We know all the that you can see in the picture. In the time of winter season, the keratin of the vermilion border that loses its plasticity. So it have a cracking type. You can see. So one should always lick the lip, or he tries to take off the scales from the lip, and again causes some damage for the lips. So the same thing, what we can do because of the overexposure to cold or hot, it can be done dehydration due to like alcoholic drinking, and some drugs use, some malnutrition, vitamin C, B deficiency because of the systemic eczema, because of use of steroids or Cushing syndrome. This can happen. And what we can do, if the patient's acne is correct, you can go with Vijarana Snehapana and Tiktagridam, Hatikta or Vidaryadi Kridam one can use. Indagandam Gridam also one can use at the same time. And for externally, Shadadavda Kridam or Muruvenna ointment, you can apply over your lips to prevent this cracking of the skin. And you can give Arimedadi Thailam for Kavala or Gandusha. If Arimeda Thailam is not available, you can use Tila Thaila for the Kabala. If after the Dandadavana, after the brushing, ask the patient to do Kabala or this Gandusha with Arimeda Thaila. And like you can this also, if this one also is not available, just you can make a paste of tila and mix with some warm water, and you can do kabala with that also. Okay. And she blames that when we are getting exposure to cold, our some sore skin, like reactions of the cold temperature, our extremities, toes, fingers, it's become um, so it will be affected, and the blood vessels become so constricted. And after when exposure to hot things, dilatation also happens. And that's type of that's sometimes the painful condition of the extremities. And sometimes ulceration also can happen, but the damage is very less, and it can be corrected by itself by the 3 weeks. But in such case, we can advise the patient to use that blankets and all, or gloves, and they can go with the abhinga dhanvantaram tailam or elayatikaram externally. Next comes the Shita Pitta. Shita Pitta, we know it's a cold urticaria, we can see. In our Shastra also, Acharya is telling Shita Pitta, Vadadikam Shita Pitta, Mudardam Duka Bhadikam, like that. So, why the Shita Pitta? Because of the Vadadika, because of the cold wind or the cold air, cold environment. When we are exposed to Shita, that's we are getting sort of urticarial lesion, and it is called andarvisarpada. We can anyways any in the bodies, you can do the sarpanada, that is the spreading nature of the swelling you can observe. We can compare this with physical urticaria. And this one, we can see the cold urticaria when our body is getting exposed to cold things and cold stimulus. Our body is getting irritated, and some sort of swelling you can see in our body. And it is telling in Shida Pitta or Udarta, we're telling Varadi Damshasam Sthanam Damshra, like when a bite or a sting from the that Varadi, that's like uh, stings of some sort of ticks, like some like swelling you can see in your body. And like see some picture I can see some after the mosquito bite also you are getting, no? And such bees and all, while the stings comes, we can see some sort of swelling in your body. The same way the changes you can see. And for testing the cold urticaria, we are using ice cube test. You can keep an ice cube on your forearm for 4 minutes and observe 10 after 10 minutes. Just see like this, after applying the ice cubes, after 10 minutes you can see like sort of swelling inside your body. That is called says examination for the cold urticaria. You can see that. And we know when a urticaria is coming in, is even a single lesion is coming, there is a huge pathology is behind in our body that's happening. So merely with any external application we couldn't treat this urticaria, because when our immunity is less, or when the hyperactivity hypersensitivity of our immune system, this happens. So the internal medication surely needed to control the urticaria, cold urticaria or hot urticaria, whatever the things. Internal medicine it should have a role. But for like this, we can use um, like these positive things. And it's according to the cold dependent syndrome also there, like cold urticaria, that cholinergic urticaria, some dermatographism, etc., can be seen. Then what is happening when it's contacts with the external cold things, cold water or winter season or cold environment, the enhanced vasodilatation will be there, vasopermeability will be there, and plasma leakage from the tissues, and wheal formation. And with that, the histamine stimulation of the nerve endings causes pruritus, it's a neuropeptide release, and skin response, some this wheals formation. So what is happening there? We know when an allergen, whether there will be the environmental change or with, by a food or anything, some it's entering our body, we have a protective cell in our body, we call it as mast cell. So some chemical changes are that happening inside the mast cell, and because of this attack, the degranulation of the mast cell happens, and the chemicals which will be flows through the blood, and these changes are happening. So what our aim to prevent the cold urticaria or whatever the things urticaria, we should stabilize the mast cell from the degranulation. So the things what we are doing, so internal medications we should do, like if it is a very irritating for the patient, it's a chronic condition for the patient, we should go for the snehapana, svedana, vamana, virechana, like panchagama you should do. If it is a mild thing for the patient, we can go with the shamana aushadhis. And that is the main thing what we have to do. We have to enhance our immunity, we have to do the acne correction,
Sorry for the interruption. I think there is a technical issue. Madam has left from the meeting. Please wait. We will contact Madam soon. Please wait. We have contacted the madam. There was a power failure over there. That was the issue. Please wait. Sorry for the interruption. We are still working behind that. Actually, Vaidyaratnam has introduced a new platform for this kind of webinar series. So this is our first attempt in this field, and that's why we are facing a little bit of difficulties in managing the situations. So please cooperate with us. Madam will join soon. Yes, madam, we can see you.
ആ സ്ലൈഡ് പോയെന്ന് തോന്നുന്നുണ്ട്.
Uh,
അത് ആ സ്ലൈഡ് മറ്റേ ഗൂഗിൾ സ്ലൈഡ് അങ്ങനെ വരുള്ളൂ.
yes, yes.
അയ്യോ, അത് അത് നേരത്തെ പോലെ ഒന്ന് പറഞ്ഞു തരുമോ?
Okay, start, start.
I'm so sorry. Some technical issues. I opened my laptop and it has become off and restarted. That's why I'm so sorry for the inconvenience. And we will start with our slide. Like we had started, we have reached at the Arctic area. This is what is happening. We have already said like this. And next one, on the treatment, what we have to do, that is mast cell stabilizing. We have to prevent the mast cell from the that granulation. That's why the chemicals that happen in chemical changes that happens in the mast cell, it won't enter to the bloodstreams, and the remaining things won't happen. So what we should we do for that? We have to enhance our immunity. We have to enhance our acne. That's why. So for that we have to give some acne Deepaka Aushadhi, Pachana Deepana Aushadhis you can start first. And some single drugs you can use it to the your patients like Guda Amalaki Saha. You can give Amalaki along with the Guda Jaggery. Okay. Or you can give Guda with the Deepyagam, like in Chakravarti it is telling, like Guda along with the Deepyaga, that is with the Jiraka or Ayamodaka or Ajamoda or Ajaji or any sort of that one, or Shadahua. You know, Shadagupa is the best. Shadahua is the best drug told by Sharangadara. That is a Deepana Pachana Drivyas. You can give Guda along with the this Shadahua, or you can give Gudardragam. You can give Ardraga Swarasa along with the Guda. So such single drugs also you can give to your patient. When the patient is telling, immediately they will call you. Some patients, if you are giving a number or something, they will call, doctor, after I'm exposed to cold, my body becomes so irritated. I have this sort of swelling in our body, what to do? So may not be they have any medications with them. That time you can give these things to improve the acne. Yeah? You have to protect, warm your body. Okay, so you can do. Else, if they having any Vilvadi Gulika or like Mukka Mukkadagadi Gulika or Haridra Kandam, anything which helps to make the mast stabilization also you can do. And the researchers show that the best mast cell stabilizing drug is Shirisha, that is Albizia lebec, because and so we can see that all Vishakna Ushadis can have a role to stabilize the mast cell from the degranulation. That is Shirisha. The Shirisharishtam is explained by in our Shastras. In Vaidyaratnam, you can see in Sastrayam, you can see what it is telling for the Vishobhadravas. So if Shirisharishta you are giving, so the only one drug, that is Shirisha, and all the things which is for the fermentation only we are doing, like we are adding like Priyangu is there, we are giving Ghataki Pushpa is there, we are giving Naga Kesara, like only some fermentation, like Ajwan, some sort of drugs. The main only single drug, that is Shirisha, we have to make a shaya with that, and we can add Guda. The importance of Guda there in the Shirisha Arishta. The amount of Guda is double than all the Arishtas explained. So Guda having some role in the master cell degranulation also. So all the drugs which is explained, the single drugs also told that along with Guda you have to take. Okay, so Shirisharishta you can give. So it is a for anything that's a recurring, it should be there, have an allergic or hypersensitivity reaction. To prevent that hypersensitivity reaction, we can consider this as a Dushi Visha. You know the Dushi Visha importance. So whenever we have a contact with the Tapa, like that, like contact with air, contact with some sort of fire, some with any allergen, any food items, a recurring condition is coming to your body like allergies. We should think that it's the effect of Dushi Visha in the body. So after proper Shodhana, for a proper Agni Deepana, you can give Dushi Visharya Gata to prevent the recurrence. So Dushi Visharya Gata along with Shirisharishta, you can prevent the allergic manifestation that recurrence. So you can make use of that. And I told because of it's a continuous, it's a very irritating, it's a chronic condition, you should go for the Snehapana, Vamana, Virejana, like Panchakarma process. And next comes the Darunaka. That's, we know, it's a very, very common issue in our OPDs. Like the patient will come, even if there is a psoriasis, they will think and they will go for the treatment like like the dandruff. After they are not getting any result with that, they are coming and for this that treatment, my dandruff is not getting reduced. So we should examine the case very clearly. You take a pen or something to scrape the scalp and see if the scalp, the things that is coming as a small powdery thing, we can consider this as darunaka. If it is like a scrape, like a greasy thing, we should think about the seborrheic dermatitis. If we are taking off these things as a flakes or a thick patches, thick scales, we should think about the scalp psoriasis. So, if in the case of seborrheic dermatitis, you should not give any oil for your patients. If already we know it's a greasy thing, there's a snigdhamsha is more. If again we are giving any oil content things, we are giving apply a sneha, the snigdhamsha will increase. Again, it worsens the condition of the dandruff. Should not use. You can use only Tribala Kashaya. You tell your patient, wash your hair with any decoction, especially you can give Tribala. You can use neem leaf decoction to wash your hair, wash your scalp, to clean your scalp. And after that, their scalp become extreme dry, use virgin coconut oil for the extent. We are calling it as venda velichenna. You can take this coconut milk, and for easy preparation, you can keep it in a refrigerator for 2 to 3 hours. After that, if you are taking, the water content will be the down portion, the creamy will be the up. Take off the cream portion and make this oil. You're getting the virgin coconut, that's when the velichenna, this oil, you can use that for the external application. No other medicated oils you can give them. And if it is dandruff, you can daruna kandura ruksha kesha bhumi prapatyate kaphavada prakopa. There should the prakopana of kapha and vata, and there will be kandu, and there will be the rukshana of the scalp and prapadana of the skin. So what should do if this is because of sorry, it's maybe we are not applying any oil. The scalp becomes so dry because maybe from improper cleaning, and maybe sleeping during the skabha, increasing the ahara viharas. The kabhavada dushti will be there. It causes the darunaka. Kandu will be there. Kesha shudi, falling off the hair. Swapa, some abnormalities some on the scalp, and ukshata, tokspudana, you can see. And what are the things we should do? You can go for the snehana svedana, you can go for the nasya, one can go for the anutaila nasya. Ajari is telling in our dinacharya, you should do for anutaila nasya daily. You can prevent that. You can go for the nimbataila nasya. It's told in Shiroroga Digara and Vagbada. It should prevent the khalitya, palitya. They can use nimbataila. How to use the nimbataila? If you are taking 10 ml or 100 ml of nimbataila, add 100 ml of milk and evaporate the milk content. That time the nimbataila will be pure shodhita nimbataila. That nimbataila you can use for the nasya. You can use that. Okay, I like that. And kshanana also you can do. And if the severe condition, you can go for the shirodhara, or you can go for the murthani taila, you can go for the shirovasi, etc., according to the condition only. Otherwise, you can use dudura patradi kera tailam, eladi kera tailam, etc., or some for the external application. And you can use this triphala kashaya for the kshanana purpose. Triphala, what's the importance of triphala? It reduces the dukkada kleda medaharam. It reduces the kledatva. So it prevents the, again, it stabilizes the water content in the scalp. So it helps to that dehydration, and also it stabilizes the scalp cells. Okay, you can use that because tribala itself is a rasayana. And if severe this one, you can use this amalakadi labam externally over your scalp. That's amalaki churna 2 parts, ishtimadu 1 part, shuddhatangana half part. And in takra, you make a paste and you can apply over the scalp area and you can wash off that. And this one also you can try in the case of darunaka. And the Eladigana Churnam, it's available for the Vaidyaratnam also. You can take that Eladigana Churnam mixed with Tandulodaga. Tandulodagam is that is Kashayarasam. So, importance of Kashayarasa told by our Acharyas. It's you should use to cleanse the our skin in the case of winter, Shishira Rutu, Hemanta Rutu. So, uh, see, Sharangadara Samhita, you can see this. The Tandulodaga, you can take the Tandula mix with the Eladigana Chuna, apply over their scalp, and do the just a mild scrub, and you can wash it off. This also prevents the Darunaga. You can make your skin so healthy. And next comes the Arumshika. Arumshika is when some associated with Darunaka, there should be some pitakas, some sort of small boil eruptions will be there, sometimes with oozing, sometimes without oozing. If oozing, no need of use it. Don't use it oil. You should do only the kshalana. When there is any, this kushta is a sandarpana vikara, there should be kapha, pitta, dushya. And when again we are doing any snehana karma, is a kaphadushti will be there, and again it causes the uh, that worsens the kushta condition. So when there is an oozing, there will be kapha predominant. Don't go for any sort of oil. Just do the kshalana to remove the excess oil, excess nikhada, excess clay tattva from the site. So do only Tribalakshalana, or you can use Nimba Patra Kashaya Thara for cleansing the scalp. Okay. And after that, you can use internally. If it's a severe case, internal medication is needed. Nurgundiadi Kashaya mixed with the Nimbadi Kashaya you can give. And after the clay Tattva it finishes, the scalp become dry, you can go for Malatyadikaram external application, Eladikaram, Kapavadaharam, you can go the external application, and you can, for the cleansing purpose, you can use Patha. Padha leaf, I already told it is Cyclia peltata leaf added with the maricha, but the tender leaves of maricha. Make a paste, and you can use that for the as instead of shampoo. All the shampoo what we are using makes the scalp again dry. So in the case of a dandruff, we are giving any sort of shampoo, it again causes dryness of your area. It is telling that one which have more foam, one which is so smelly. So it's both makes the skin again so dry. So better to avoid that, and you can use any sort of our chunas like Siddhartha Stana chuna, or like Eladigana chuna, or Mashadi chuna, anything you can use your for the cleansing of your scalp. And next comes the disease that is Vipadika. Vipadika, it's Vata Kabacha in nature. We can consider the Palma planta sort of psoriasis like peeling of the dry scales, very hard scales from the palm or plantar areas. So, what is Rajaryas explained? You should do some avagahana, some pada sekatsa, another form like a pada nimajjana. You can use any decoction like Tribhala you can use, Alpamradiksha, this Kashaya you can use, or any Siddhartha Kashaya you can use for the Pada Nimajjana. After the Kleda Haratva, after alleviating the Kleda from the side, you can use any sort of some sort of oil like some Mahisha Grida, or like Pindatailam, or like Kajida Pindatailam, or like any oil that retains the moisture used to Nili Daladikaram. Actually, it's explained in Vishadika and Luda Vishaprakarnam. That's also you can make use to makes the texture of the skin so clear. Okay. And another disease is telling us Padadari. It is Vada Pittahara in nature. Actually, in Vada Pittahara, the Vada Rekta Dhigara Chilsa we have to do. So in that, after oozing stops, after the skin becomes so dry, you can use Jadamayadi Churnam. You can mix the Jadamayadi Churnam with milk and make it a boil it and make a paste, and you can apply over the Vipadika area, so that it helps to retain the moisture in the area. It helps to prevent the scars, heal the scars. It heal the cracks of the skin, and the skin becomes so clear. So, like if the internal medicines you have to give the same way externally, Tribhala Kashaya Shalanam and Pada Nimajjanam, like as I told, Jivandya Demakam, Kajita Pindadailam, Mahashagradam, etc. you can use. And then Mahamanjishtadi Kashaya, after the using, reduces. We can first stage, you can go with Padolamuladi Kashaya for severe stage, because like if Bahudosha Avastha, you should do go for the Shodhana. So Padola Muladi Kashayam you can use. After that, you can go with the Padola Kadirohinyadi Kashayam, Kulagadi Kashayam, and you can just Kaphavittahara yogas you can use. After that, you can use some like sort of drugs which is Rakta Prasadaka, and also it should not that increase of the Vata and Pitta. So Vata Rakta Dikara. So the Mahamanjishtadi Kashayam added with the Mahatiktam Kashayam you can use at the later stage. At that time also, the same time, if the Agni is correct, you can start with Mahatikta Gridam internally to prevent the recurrence, to prevent the cracking, that prevents the for that scaling of the skin. Okay. So next comes some sort of fungal infections. Also, you can see in this winter season, that is athlete's foot and ringworm is the most common fungal infections you can see. Athlete's foots, ringworms, Tinea corporis, and jockey some Tinea cruris is very common. When this patient is coming to you, sometimes we are misdiagnosed with some sort of flexural psoriasis also. So, what should we you see when a ringworm patient is coming to you? In a ringworm patient is coming to you, you examine the area very clearly. You can see it should be a mandalakagaram. That's it. Dadru is explaining. It should be a round patch, and the area, the surrounding the margin should be like the fungal. That spore will be like a pearl is arranged everywhere. Like a you can see the elevated margin of the dadru. So while with that, you can diagnose. When a patient is coming to us after corticosteroid application, sometimes this margin cannot be found very clearly. But just examine the case, give some medicine and observe for 1 week. After stopping the steroid creams, again you can see the that margin will be very clearly with this spore. So such condition, we should go for the antifungal correct that treatment. In this Tinea cruris, it's you can see in the inguinal region. Sometimes submammary, it's under the breast also you can see. Okay. And some cutaneous candidiasis also you can see in this winter season. So you should consider this as dadru and we can go for the treatment. If it is severe condition, internal medications is needed, because most of the cases patient is coming to us after a long term treatment. Patients after maybe they tried a lot of treatments, and maybe at last they are coming to us. So anyway, maybe with a history of 2 months, 3 months, or 6 months, they are coming to us. So surely we should start with an internal medications. The Kundiadi Kashayam is available for Vaidyaratnam. You can use that. And Kulagadi Kashayam, because after the Krimihara Ushadis, because this is a spores of a fungal, we should consider it as a Krimi. So Krimihara line of treatment you can start. You can add with Krimikna Ushadis. Krimikna Vadika you can give. And after 1 week of Nirkundyadi Kashayam, Krimikna Vadika, you can go with the like Krimishodini, like 1 to 2 to 3 weeks, you can continue the medications. After that, the itching reduces, and after you should start with some liver protective kashayas like Kavapittahara Ushadis, like Kulagadi Kashayam, Padola Kadurohinyadi Kashayam, etc. You should start. At the same time, internally with the Vilvadi Guliga. Vilvadi Guliga, Vilvadi Guliga is that. Everywhere as a Vishahara Ushadis, as a liver protective, as a uh, like antimicrobial drug. You can use the Vilvadi Gulika internally. And Nimba Haridradi Churnam, actually for Vaidyaratnam, it is calling as Nimbadi Churnam. You can make use of that by adding with the takra. You mix with takra and make a paste of that. Some patients may got some allergies, so you can make cook that Nimbadi Churna along with takra, and you can apply externally over the affected areas. Wait for 15 to 20 minutes and wash off. At first time, only do the kshalana. Okay, don't do any lepanas. At the first time when a patient is coming to you, when after proper Agni Chikitsa, after proper Shodhana, when the doshas take ashrayas in the skin, then only go for the lepas. So first, you can do the kshalana with the Nimba Haridradi Churna, or Siddhartha Snana Churna is available for Vaidyaratnam. You can use the kashaya with that, and you can do the wash the area, the affected area with that. Okay, it's give better result. And also, if it is severe, you take tangana and make a churna, add with nimbu suvarasa and apply over the area. Wait for 5 to 10 minutes. Wash off. It removes the superficial affected pores of that fungal layer from the body and makes the skin so healthy. And after that, with the internal medicines and with external medicines. When the skin become clear, you can use any gandhaka oil. Gandhaka contains oil like Kimshuka Patradikera or Gandhaka Taila or Gandhaka Raja Taila or any like Tailas which contain sulfur or Gandhaka you can use to prevent the recurrence. Okay. And some drugs like Chakramarda, Acacia tora or Acacia angustifolia, anything you can use, or Araguda Patra, easily available in our homes. So take that Araguda Patra, just make the paste with takra and just cook it. And after that, just take the lepa, apply over the area, leave it for 15 to 20 minutes and wash it off. It's also clear the fungal growth from the affected part. And if it is affect the whole the body, the patient, no, they will not come to us until it reaches to the abdomen or to the another, spreads to another area. So when the whole body is affected, you can do takradhara, which is processed with argudadiganam kashayam or the gundyadiganam kashayam for the external purpose. And Konnela Kadakadi like clay pass are available. And for the external also, you can use that. Siddhartha Snana Churna is the best choice for the Snana purpose. And athlete food, that's also, it's a tinea pedis, very common in winter season. And it takes 3 to 6 weeks at least treatment uh, to make the area so like ruksha. Okay, whenever there is a this humid condition, that times growth will be more. When it is affecting the hand, it is called tinea mana. And alasaka, it's explained in Ashastras, in our Kshudra Rogas, that is alasa, Dushta Kardama Sanspasha, because of the when we are with contact with the Dushta Kardama or any sort of humid things. And that's a Kandu Kleda and Vida. There should be Kandu and Kleda, Antarangulyo in between the angulis, in between the fingers, you can see that. So what there's we can see the Kandu and Kleda should do Kleda. So you should do the Kabhaharatva. So our treatment should based on Kabha Pitta Hara line of treatment. So Padola Kadurohinyadi Kashayam you can use, Kulagadi Kashayam you can use. Kulagadi is explained in Visarpa Vispoda Pragaranam. In Sahasra Yoga you can see. Aragodadi Kashayam you can use. And Tribhalakshalanam. And our Acharya is what he is telling Aranalakshalanam. You should one can use Aranala for the cleansing purpose. Aranala is again, that is the Kashaya, there's a Samshuktatva will be there. So instead of Aranala, easily available Dhanyamla Dara. Dhanyamla is easily available. So you can use Dhanyamla Dara, which cleanses the area very fastly and makes the area so ruksha, and the clay tattva will be take off very fastly. And after that you can use of any sort of ointment, and Muruvanna ointment is best to apply. And Mahatiktaka lepam is available, which contains tutta. It is a brana shodhana ropana. So you can use that also after when the area become dry to prevent the recurrence. You can make use of that. And the next, some two diseases are there: atopic dermatitis and psoriasis. These things get worsened in winter season. So I'll just tell this very that these two diseases also. That atopic dermatitis is a common type of dermatitis. What is the main thing? That the itch that rashes. We will reach, the rash will form. Because of the rash, again we will reach. This is as a cycle. It will each scratch cycle. It should go on continuing when exposure to any sort of allergen, especially cold or hot, can cause. In early childhood, it can cause, and maybe sometimes improve with the 5 to 6 ages, exacerbation, remission, and like that. When the external contact, it can you can see the remissions and the exacerbations. Pathophysiology, actually the actual the what there is pathology is not known, and it is one hypothesis regarding the hygiene. Also it's telling that when we are making our babies, we are taking care of babies more, we are not allowing the baby to that play in the external ground or something, and there will be less immunity So there is a chance of getting atopic dermatitis more. We are giving our baby, they will play outside, they will play in the winter, they will play in the rain, they play in the hot sun bath. Okay, our immune system will be more strong, and there is a chance of less affecting with the atopic dermatitis. There's a hypothesis is there, and there's a chance of genetic, so family from the generation to generation, there's a chance of getting this atopic dermatitis. And the environmental um, affection, that's effect of environment also there. And what is happening, this disruption of the skin barrier, that function, take off the moisture from the body, again the area become so dry. When contact with any allergens, there's a chance of getting staphylococcus infection also. Here, so that we are losing the natural moisturizing factor, and of some reduction in the protein level filagrin. So that's coming, it's in the dry skin, causes the water evaporate from the skin, the area becomes so dry, and some itching happens, it causes inflammation, and again this itch and dry cycle goes on. And significance, so the symptoms varies from one patient to another. And three, in the infantile atopic dermatitis, childhood and adult, you can see. And there is a chance in the, if it's affected in the early childhood, 60% of chance to cure, and the adult only 40%. And sometimes affected with the papules, plaques, and pustule formation. And you can see, maybe affected soon after birth, or maybe after 5 to 2, after the years, 2 years it can start. And you can see most of the flexure areas, there should be a chance of atopic dermatitis, rashes is there. And also some sort of toilet allergies also the baby can cause when they have started to use the European closet. That's a sort of atopic dermatitis itself. When the contacts in area directly for more than 2 to 3 minutes, there will be a rash formation. Like sometimes a honey crust type of lesions also you can see. In adult phase also the same thing. The area becomes so dry, and it will be keratinized, and goes on itching. The area again get like irritation of the area. Again the skin becomes so dry. Keratinization happens. You can see, and is there is a atopic dermatitis, the eczema, the allergy, skin allergy, and the asthma. The three conditions are connected. It's a calling as atopic march. Sometimes subsides, eczema subsides, there may be a chance of getting food allergy or rhinitis or asthma. So when the dermatological condition reduces, there is a chance of increasing the respiratory allergies. So what should be our aim to treat? We should not treating the allergy there. We are enhancing the immunity. We have to increase the Agni We have to increase the enhance the immunity. Then only we can treat this atopic dermatitis. Some crusty formation if there is affected with any infections. These are the criteria how to find this atopic dermatitis. And when a case is coming to you, before you are reaching the this one diagnosis, you have to exclude is, it should not be scabies, it should not be seborrheic dermatitis, it should not be contact. These are the differential diagnosis we have to do in atopic dermatitis, like ichthyosis we already told, psoriasis. Okay. And what is treatment? What are the tests we can do for the diagnosis? That like that blood count, total blood count you can do. And the main thing you can observe that increased immunoglobulin E level in the body. That hypersensitivity reaction. And of course it should be elevated. And some skin scabs you can take, a staphylococcus aureus presentation, and allergy test, and some sort of biopsy also we can do. And what are the aim? First, a baby is coming, first if patient is coming to us, what should our aim? To manage the flares. Then after that we have to do we have to enhance immunity to prevent the recurrence. And we should consider this as Balavisarpa, and we can do the treatment as Vijayachika. I know it's a big topic. As a atopic dermatitis is also one topic. At least we should present for 1 hour. So I will minimize these things just for your knowledge and just for your this awareness. I'm telling. In the initial stage of atopic dermatitis, the dosha predominant will be there is the pitta kapha. So our aim, what should I do? We do for the first time, the pitta kabhara line of treatment we have to adopt. So mulagadi kashayam you can use, nirgudyadi kashayam you can use, vashaguluchadi kashayam is used. So what's our aim? First to prevent the kledatwa under the body. And the arishta, if you are selecting, you can use lodhasavam, you can use sharibadhyasavam, ushirasavam. If itching is more, if Ig is elevated, you can use sort of this. And if any infection sustained, you can use amrdarishtam added with punarnavasa or aragodarishtam added with punarnavasa to prevent the inflammation over the area. And you can use rajanyadi churnam, you can use rajanyadi along with the dushivishari or rajanyadi along with the vilwadi gulika according to the condition of the patient. And if it is any infection, if the fever associated with fever, like any sort we are suspecting in staphylococcus bacteria, gobi chandradi gulika is the best option to treat that. You can add that along with the rajanyadi or along with the haridra kandam, you can add that and you can give, or else with any sort of arishtas you can mix gobi chandradi. If you want a good result, you can use gobi chandradi gulika along with the gentle coconut water. It is mutrala, it is immunomodulator, and it reduces the pitta very fastly. And don't use any sort of ointments, any sort of oil, any sort of lepas at the first stage. Only do seka or kshalana or avagaha. Okay, or some sort of sponging also you can do. In the later stage, after when the kleda reduces, we had done the kapavitahara line, we should go for the vada kapahara line of treatment. But it should be pitta virodhi in nature. So aragadadi kashayam you can choose, nishotamadi kashayam you can use, vajragam kashayam you can use. In the later stage, panchadiktam you can use. You can add dushi vishari, as I told, whenever there is a chance of remission, there's a chance of recurrence, it should be a chance of dushi visha inside that. So you can add dushi vishari gulika to prevent the recurrence. And Haridragandam you can use, Manibhadra Gulam you can use. If you are using Manibhadra Gula as a Shamana dose, you should take at the bedtime. If you want to give Manibhadra Gulam as Shodhana, you should give in the empty stomach along with hot water. It causes some sort of purgation. And after that, if Agni is correct, everything is there, you can go for Aragudam Hadikta Gridam. It is available for Vaidyaratnam. And you can do that Aragudam Hadikta Gridam for the Vicharana Snehapana or for the Acha Snehapana according to the condition. You can use Kalyana Gridam, you can use Indaganda Gridam. While seeing the ingredients of Indaganda Gridam, you can see it is told us it's Dalavarthaga, it enhances immunity. And also, while analyzing the drugs of Indaganda Gridam, you can see that all the drugs having an antihistamic action. So, if you are using the Indaganda Gridam in the case of atopic dermatitis, it's very best to control the itching also. Okay. And for the external application, as I told, you can go with the Tribhala Kshalanam. You can do Nirgundyadi Kashaya Dhara, and you can do Argudadi Kashaya Dhara, Eradigana Chuna for the Dhara, etc. Any first stage, don't go for any application, only Sega or Kshalana. In the chronic cases, Nimba Patra with the coconut milk isol, that paste removes the that keratinization very fastly. And the shariba, you cook the shariba or the churna of shariba, you can use with the coconut milk. This also reduces the discoloration, it reduces the keratinization, it reduces the dryness of the areas also. And the same way, Parandi Pushpa or with Ashoka Pushpa, you can make use of the in the same way. In the later stage, if after any sort of lepas or sorry sort of seka, if after this any sort of burning is present, you can use this tikta ghee for the external application. You can use the Dashapushpadikeram for the external application. The Dashapushpadikeram, actually there is Dashapushpa is very immunomodulating, it's anti-inflammatory, it's Vranahara, it's Vranashodhana, it's anti pruritic drugs, very good medicine for this. And Neelidhanadikaram, actually I told it is told in Luda Vishaprakaranam, it's a best track to make the skin stabilizes the skin, and you can use Neelidhanadikaram and Nalpamaradikaram and Shadadodakritam, Shadadodakritam. It's actually make use with the Nalpamaradika Shayam, Shiri Vrishatoka Shayam, that reduces the burning sensation very fastly. And if there is much elevated Ig, you can see in the case of atopic dermatitis, you can use Dushirishari Agata along with the Shirisharishta. You can use the combination of Ashaguluchya Kashayam along with the Lodhrasavam. If we added with Dushirishari, it's very fastly, you can see there is a reduction in elevated Ig. And if atopic dermatitis is associated with the Shwasa, if the both dermatological condition and the respiratory condition is coming together, you can make use of Elaganadi Kashayam and added with the Govi Chandradi Gulika. And then we are coming to the end with the another disease which got worsened in this winter season, that is psoriasis. So many misconceptions regarding psoriasis. It's spreading from one person to another person. It's not spreading from another one to another. And psoriasis can be completely cured by Ayurveda. This is also a misconception. We can treat the patient without any scar. We can maintain the patient, but he should be very strict in his diet. Okay, and prognosis, very good prognosis with Ayurveda. And we have to educate the patient. We have to aware him, make aware him about the repetition and continuous follow up. And we can consider this psoriasis in Ayurveda with Kidipakushta, Ekakushta, Siddhakushta. Any of these we can consider because both of these three are Vada Kabaja in nature. So any of these, according to the symptoms, we can make under these three. And sometimes this Vada Kabaja Kushta associate with the Pitta and Venda. That's that time the burning sensation will be more. We can consider erythrodermic psoriasis to this, like Vata Kabaja associate with the Pitta. Sitmagushta, it is Shvedam Tamram, it is Alabu Varnam, it's somewhat whitish in color, and Andahasnikham Ruksham Bahi, how clearly he is telling while explaining the candle wax sign. Acharya is telling while we are taking a sort of it's something, and we have to scrape the areas of the psoriasis. In externally it will be very dry, but we are scraping, we are getting some candle wax like a snigdha, like greasy things we are getting. How beautifully our Acharya is telling Andha snigdham vihir ruksham. Same candle wax signs you can see. And it is we are telling like Kidiba is Kinakhara Spasham. We are touching a psoriasis wound, psoriasis patches. You can see that we are touching in a wound. Oh, Chakravani commentary, he's telling it's hard to touch, rough to touch. It's very hard and very rough to touch. And Ekakushta is telling it's Malsya Shakalava. The scales are falling like a Malsya Shakala. And management according to the dosha lakshana, which dosha is involved, which dhatu is getting involved, how many the chronicity, since how many days, how many years, how many months the patient is getting affected, and which dhatu, which what are the comorbidities affected for the patient. And according to that, if the patient is balavan, if the dosha dushti is prabhuda, we should go for shodhana. The patient is alpa balavan and the prabhuda dosha, we should go for shamana, because the patient is not having bala for shodhana. After making the patient balavan, you can go for the nitya shodhana or something. Okay. And you know what is psoriasis? Sora, the word itself means itching. So an inflammatory skin disease which having itching, we can see that about the psoriasis. In normal patient, a person, it takes 26 to 28 days to fall off the skin from the area. But in the case of psoriasis, it takes 3 to 4 days. That means very fastly, the or complete the keratinization and the layer formation won't be there. Very easily it will fall off. So what should we do? The paga. We have to control the paga. We have to control the pitta. We have to correct the pitta internally and externally. So many etiological factors, autoimmune reaction, inflammatory, climatic changes, everything can trigger psoriasis. Some medication like lithium, antimalarial medication, and endomethacin, very commonly nowadays using endomethacin for the pain management. So it causes some sort of skin irritation in long-term use. Stress, obesity, and smoking. Obesity, obesity is a sandarpanotha vikara. Kushta is again a sandarpanotha vikara. So what is our aim? Our treatment should be avadarpana. So avadarpana is kledahara in nature. So rukshana, ruksha virejana, we should start. Okay. And pathophysiology also, when the factors, the layers won't get much cell maturation won't be there, it will fall off very fastly, and sometimes affected with restricted movement, joint pain, inflammation, and there is a chance of psoriatic arthritis also. These are the common areas it's affected with psoriasis. Most probably, the atopic dermatitis, it can be seen in the flexor area, but in the case of psoriasis, you can see it is the extensor area and symmetrical distribution of the patches also you can see. And if it is affected, it's a psoriatic arthritis, there will be elevation of ESR and C-reactive protein. And what is our aim to treat? Slow down that rapid turnover of the epidermis. And we have to the resolution of the already existed lesions. Control the cycle, that's a cell formation. Okay, there is a not much cure for Ayurveda, but we can, without any lesion, the quality of life can increase very much without treatments. Without any lesions, we can make the patient very all right, but he should follow good diet, and he should come to us for the proper follow-up and that medications. So I will explain 2 to 3 cases and we'll wind off the session. And this is a case of Ekakushta. Actually, I told Malsi Shakalavat Ekakushta. There's like the patient is coming from Goa. Actually, he has the history of this one long 6 years back. And when patient is coming to us like this condition, and 45 years, and he has a history of started with some scaly patches all over the body associated with itching, dryness, flaking, and whole body burning sensation. Actually, we don't kaphavada added associated with the pitta you can see the burning sensation. And he starts this by the age of 25. And he in Goa he took some treatments and completely cured. After that, he started some sort of again some this sort of lesions and this arthritis also. So they had done Dhanyamladhara and all the lesions has come out. And when auspit sign is positive, that when we are taking off the scales from the body, that's some sort of bleeding spots you can see, that's auspit sign. When the patient is coming to us, the PASI score, the affected areas, and the erythema, the surface area, the induration, the thickness, everything is a most value E4, S4, and I4. And body surface area affected, more than 90% of the area affected, we so given the score 6. Then investigate global assessment 4. And these are the things. There's a person patient global assessment. There's no evidence, no erythema, 0 score, and faint erythema score 1. And I think Dr. Aravind, he will explain some case studies very elaborately for you. And elevated red color 3, and dark deep red color is 4. That's why we give this the patches for 4. And with investigations assessment same, clear 0, and almost clear 1, mild thickening 2, and bright to red that moderate 3, and severe we are giving the score 4. And the quality of life index, we are giving so many questions to the patient for how much itchy. If he's very giving the score as for very much, we are giving the score 4, like that. For 10 questions are there. With that, we will uh, take the numbers, and he for him out of 30 he got for 26 of his score. And we have to analyze the dosha. The dosha predominant is Vadakabaja, and as he's complaining of burning sensation is Pitanabandha. And Prabhuta dosha dushti. You know what is the Prabhuta dosha dushti? The patient is having a Pivaka, he's having a Ruji, he's Taulia in nature. Is it visible? No?
Yes, madam. Yes, madam.
There is Panduda, and he's having heaviness, and there is Pitaka, Kodha, Kandu, and Arati, Alasya, Shrama, all the symptoms, Indradasha, his Ashasta Sopta Darshanam, everything is there. And Belavanna Pranasha, we can see. So, what is it? Bahudosha Lingani, it's all the Lakshanas of Bahudosha. Then, what is the treatment? Tasme Sam Shodhanam Hidam, we should go for the Shodhana treatment. So, we planned to give Shodhana with the Padola Muladi Kashayam. So started with Padola Muladi Kashayam, Duksha Virejana for the 6 days, that 7 days we have given. After that, for the Agni Deepti, we started with Vaishwanra Churnam, and we started Snehapana with Indaganda Gridam. And fifth day, he shows some Snithalekshanas, and After that, we have stopped and did Dasa Virejana. And after that, started Abhinga. And the same time, as there is some swelling, started with the Punanavadi Kashayam, Chandraprabha Gulika. As he's having some burning sensations, the Guluchadi continued. And after that, we did Kshiradhara with the Guluchadi Kashaya Churnam. And we did uh, again Abhinga, Ushmasveda, as the patient is got discharged for 2 weeks because of the COVID. And we did Pirinyu Tadaval, that is Dhara with Pindatailam, one Rajasuri, that's Vitpala Thailam. I think it's available for Kotakil. Sorry, it is Vaidyaratnam. And after that, we did Shastika Sveda with the Guluchadika Shayam. And this was the condition when patient is admitted. And this is after Snehapana, and this is the while he's discharging. And this is a patient we did that follow up for 3 months with the Gandhaka Rasayana, Rasayana therapy, and this is one after 3 months of discharge. And while discharging, the PASI score is 0 and DLQI is 0. And Pathyapathas, we don't allow the patient to take Adhika uh, Amla Levana Aharas, Katu Amla Levanam, and some salty pickles, maida added foods, and junk foods we should avoid, and black gram food we should avoid. And the total duration had taken 47 days of treatment. And for the follow, we had given Gandhakaraja Rasayanam 10 grams in the empty stomach, Madhusnuhi Rasayanam 10 nights, both contains Gandhaka, and Shuddha Durvadikera for the external application. And again, one case of erythrodermic psoriasis. I think doctor will share his one slide for that.
Madam,
And oh,
sorry to sorry to interrupt. Actually, we are 8:10 right now.
uh,
Time is so. If you can brief the slides, then it will be
yeah,
convenient.
it's
Because,
finished. It's finished.
sorry for that. Okay.
Okay, okay, no problem. And this is one slide. He will say the treatment the same way we had done the treatment for this also. And the general erythematous lesions you can see. And the same thing, we have started with the Pitta Rekta Hara line of treatment in the case of erythrodermic psoriasis. And this is the condition while discharging, the same, nothing. He will explain the case very nicely. It's again one erythrodermic case like this. We did the Pitta Rekta Hara line of treatment for this case also. And again, some same case, another one is purely Vata Kapaja in nature. And same the way we had in this case, that Snehapana with the Tikta Kritam, Kalyana Kritam, as the patient is much depressed, and only the medicine has been changed, all the treatment, and he did Takradara also. And this is also another condition, same line of treatment. Whatever the you do, analyze the dosha, what is predominant, and go for the treatment. And same, that's in Dhara with Tribhala Kashayam, and did Snehapana with Ayurvedam Hadikta. All the things are same. And this is condition. And thank you. And if any doubts also you can ask. I think I'm so sorry for the late this presentation.
Thank you, madam. Thank you so much for a wonderful presentation. It was loaded with a lot of informations. Though we had some technical issues, it was very interesting topic which we have dealt. And before starting our question answer session, there is a slight presentation from my side also. I will explain what is my view regarding this kind of conditions, and it will take hardly 10 minutes. Afterwards, we will have a question answer session, and we are receiving a lot of questions inside the chat box also, and within 10 minutes we will enter into the question answer session. Okay, so let me share my slides. Before starting my presentation, madam has already covered a lot of diseases like ichthyosis, and a comparison between the recommendations to prevent the skin diseases during the winter season and our Ridujara. It was very wonderful, and she has explained a lot of conditions like chapping of lips, chilblains, Shida, and mast cell stabilizing with the help of Shirisha. And then Darunaga. She has differentiated what is the difference between Darunaga, seborrheic dermatitis, scalp psoriasis very beautifully, and importance of special drugs like or single drugs like Nimba Tailanasya, then Arumshiga, Vibhadiga fungal infections, and atopic dermatitis and psoriasis in detail with 2 or 3 case presentations. So before I mean bowing my head in front of the Murthy Devi, then clinical approach towards the skin diseases with special reference to the winter season. Why we have selected this topic in this particular web series is why, because we know that more than 50% of the OP patients in general practice is suffering from skin diseases. So we should have a minimum idea regarding how to manage the skin cases. And mostly above 50% is simply curable. It's very easily manageable. Only 10% is we are having a lot of difficulties in such case. So which means 90 percentage we are easily we can easily manage the through the Ayurvedic management. At the same time, you should we should be aware about the what is happening in the modern system also. Why? Because we are getting a lot of patients coming to us because of the repeatability or recurrence of the diseases due to the modern management. So there lies the presence of or the importance of this particular topic. Madam, could you please stop sharing your
Okay.
slides so
Sorry.
that it will be easy to view the other one? Okay, okay. Thank you, thank you. So as we have already discussed, there is a very huge spectrum when coming to the dermatology inside the Ayurveda. So don't worry about that. It can be easily manageable, and I will tell that in the coming slides. So on brief, we have discussed a lot of medicines in the last few minutes. For seasonal allergies, if you can say, if I can say, a first-hand prescription doesn't. You please don't misinterpret this thing. If you are in a dilemma to be start with which medicine, if you are in a dilemma or if you are a beginner, you can try with this Arabada Amradadi Kashaya 15 milliliter plus 45 milliliter warm water BD, then including the Dushi Vishari tablet 202 with honey, then Haridra Ganda 1 teaspoon, and externally Padola Kerakrutam plus Neeli Thailam or Padola Kerakrutam alone or Neeli Thailam alone externally. Even though I am telling as a capsule, this has got some logics. That's why I have presented this prescription. Aragoda Amradadi Kasha is very, very, very good for Shida Pitta or urticaria, like rashes which are appearing all on a sudden in this kind of winter season. And this is coming from the Vispoda, Sahasra Yoga, Vispoda Prakarana. If it is not, if this Aragoda Amradadi Kasha is available for Vaidyaratnam, or if you are having any such other options, other options like Amrita Rajanyadi or Amrita Vrishadi, if you are preparing your own medicines, that is also a good choice in this condition. Okay. Then Dushi Vishari tablet. See, there is a relevance for Dushi Vishari tablet, Dushi Visha concept in this particular situation. See, if you are remembering the Agadha Dandra classes, what is meant by Dushi Visha means it is present inside the body as a latent toxin. We are facing a lot of toxins, or we are getting in touch with a lot of toxins in one way or another way in our day-to-day life, through the medicines, through the food, through the drinkings, everything we are facing with a lot of, lot of packed foods are coming with preservatives, coloring agents, extracts, chemical extracts, everything. So we can't stop the usage of the toxins in our day-to-day life. So what we have to do while planning the treatment, we should consider these kind of delayed toxicities or latent toxicities inside our prescription. So in this particular case, the action of Doshivisha is it will get triggered with the help of certain factors. If I can quote the slogan, Pragvada Jirna Shidabra Divasopnir Ahidashanahi. See, Pragvada, the wind, Ajirna, then Shidakala. So all these are going to be a triggering factor for Dushivisha. So definitely we should consider this Dushi Vishahara Hari tablet in this kind of conditions. And regarding the Haridra Ganda, everybody knows that this is a very good drug for this particular condition in the case of Shida Pitta. Then coming to the Padola Kera Grida. This is a special medicine which is available for Vaidyaratnam. It has been prepared in such a fashion like Padola the Gana. Padola the Gana has been, those drugs, Padola Kadirogani, Chandana, Madhusrava, Guduji, Padha, and Vidam. Those drugs has been converted into the Grida. It is a Kera Grida, which means the cooked oil, the virgin coconut oil. Likewise, it has been prepared. So it is, what is the benefit of this? It will give an add-on moisturization for our skin. Okay. And this is very, very important, or this is very good choice for this, I mean, a first choice for this kind of conditions. And in certain cases, if we are suspecting a toxicity in the body, what I'm telling is an external toxin, an add-on toxicity apart from the Dusha Visha, then you can go for Mealy Thaila, because it is a very good medicine, which Madam has already explained. This is mentioned in Luda Visha. It is having a lot of specialities in this particular situation. Okay, so with this in your hand, sometimes what will happen means the symptoms won't subside with this kind of medicines. So there lies the importance of understanding the condition with the help of our Ayurvedic basic principles. Now I will share a case in which what I have done to manage this particular case. See, this is a case of erythrodermatic psoriasis. This picture has been taken by the patient itself. I mean, they have shown this picture to me, and this condition got worsened like this. This is how I have received this particular case. So how it can be diagnosed? You should check whether there is a presence of erythema, whether there is a presence of swelling, whether there is a presence of scaling, itching, and this scaling with the thick lesions. And this patient has got a severe pain, and he is unable to move in the bed. That was a condition when this patient came to us. Okay, and his PASI score has taken as 56. Okay, so this is a stage one of the condition, and the medicine has started. I am not explaining the medicine right now, because I am going to explain after this kind of pictures, and these medicines will be providing as a note to all the viewers who has participated in this particular webinar. Okay, so don't worry about the speed which I am going, because due to the lack of time I am moving a little bit fast. Then in the third stage, this was a situation, and this was the condition during the discharge, and the patient was completely normal when he got discharged from the hospital. So during the phase one, it has been given for 10 days. It is because of the severe burning sensation, severe pain, I have planned for a Pitta Vata Shamana treatment. It has started with the Chandanadi Kashaya. Chandana Parpadagadi Kashaya will be a good choice in this particular condition. 15 ml plus 45 ml warm water, BD. Then Amrita Gugulu has been selected for a Pitta Shamana, more predominant. I mean, considering the other Gugulu, Amrita Gugulu might have worked in this particular situation. Then Gopi Chandanadi Kudiga, 1 TDS after food, and then Gobatmajadi Kera Thailam. This is a very wonderful medicine. I mean, it was worked a lot, helped us a lot in managing this particular situation. Why? Because see, this patient, when treated earlier, has tried the famous Vitpala Taila. It's a wonderful drug for the sigma or psoriasis. But actually speaking, this patient has got some irritation in the case of Vitpala because it's more potent. So slightly milder Thaila has been selected as Gobatmajadi Kera. Here also it has been taken, it is preparing as a special medicine Vaidyaratnam as virgin coconut oil. Okay. So this is also coming from the reference of Sahasra Yoga. In Sahasra Yoga, it is telling as a Gobatmajadi Grida, but here we are converting it as Gobatmajadi Kera Grida or Kera Thaila. Then along with that, we have given the Kaisega, Kshiravrikshatva or Nalpamara Kashaya has been given. Then patient was having a lot of wounds, because wherever he is trying to itch, there comes the wounds, and even the joints, all the joints were unable to extend also. So in those areas, I have applied Shadadavada Krida as ointment. After 10 days, the patient got relieved from the main symptoms, and then we have planned for a Shodhana Chikitsa. This is a Bahu Dosha Vyadi. So we have planned for Shodhana Chikitsa. Snehaban has given for 7 days using the Aragvada Mahadikta Grida. The importance of this one. This is also a special medicine prepared by Vaidyaratnam. It is added with Mahadikta Grida. It is added with the Aragvada. And this is having more potency than Mahadikta Grida, because it's having a more Kleraharatva, more Kabhaharatva, etc. is attributed for this particular medicine. Then we have done Vamana, then again Snehapana, and then Virechana. Then coming to the phase 3, Kaba Pitta Shamana treatment has been planned with the help of Takradara, mixing it with the Nimbadi Churna and Eladi Churna. Then Abhyanga with the Gobatmajati and Neeli Keradaila. Here, usually what happens means, in the case of psoriasis, we used to tell the patient to expose to the light sunlight during the early morning. But in this case, we cannot advise that, because it is having a more pitta predominance, more sensitive skin this patient was having. So Aragada Mahatikta Grida has been continued as a Shamana Snehapana. Then converted, the internal medicines was converted into the Tikta Kashai with the Madhusnuki because Robana is needed. Tikta Kashai mixed with the Madhusnuki. Then Dushi Vishari, Haridraganda, and Mani Badraguda, 1 teaspoon at night. Then moving to the phase 4 for 7 days, Kapapitra Samana and Robana, Shashtiga Leba. It's a very important therapy which is using for psoriasis kind of conditions. Here, what we do means Shashtika, everyone know that this Shashtika is using a Shashtika Pinda Sweda commonly in the case of Vada Vyadi, but in us, for us, this is a very good rejuvenating medicine for or moisturizing medicine or for this kind of psoriasis. I mean, after the, it's a kind of rasayana therapy which is giving externally. So Shashtika Leba has been, this Leba will be doing continuously because we will apply, keep on applying this Shashtika on the body till the treatment. And so, this treatment will be continuing for 30 to 40 minutes, and this during complete 30 to 40 minutes, this application of this kind of Shashtika Leba will be doing continuously. Beware, it should be hot. Otherwise, what will happen means this patient will start shivering or more Vata Pragoba will happen. So that should be in your mind while doing the Shashtika Leba. Then Kaya Saigavi along with the Aragadadi Kashaya has been given. And then phase 3 internal medicines continued. Then on phase 5, it has been for 10 days. It is an Abunar Bhava Chikitsa as a Rasayana. Here we have selected the Tuvaraga Taila Rasayana because it has been told in the Kushta Chikitsa Prakarana. And this reference is coming from the Ashtanga Hridaya Rasayana as well in alternate days. So this was the treatment which has been done for this particular patient. You can see the result with the after treatment and the before treatment comparisons. The scale, see, you can see the scales has been completely removed and his body, the skin has become normal within this 30 or 40 or days of the treatment. You can see the wounds has been completely cured. Normal texture has replaced even in the skin in the case of scalp, and the patient is absolutely normal. And after 1 month, after the visit, after the discharge, after 1 month when he came to the OPD, this was the condition. So this is the relevance of studying or applying the principles of Ayurveda along with the, as per the conditions. So don't think that this kind of treatments are needed for all the cases. Wherever, as per my experience, around 75 or 80% of the cases are easily manageable with the short prescriptions. Only in difficult conditions we need to manage or think like this. A few more cases with the before and after treatments, which we should do, or we have planned and done the treatment as per the Ayurvedic principles. Okay. Due to lack of time, I'm not explaining all these things. This is a condition of Bala Visarpa, or in Kerala we will say it as a Karapan. And this is a condition of Kidibakushta. Okay, so the key for success is a proper diagnosis, good protocol, then right medicines and get the results. Okay, so whenever you are planning for the management, this should be in your mind. Again, this is a very huge topic. I'm just, as a nutshell or as a capsule, you can note it down. Election analysis, the Nidana tracing is very, very important, because what happens means the patient will be unknowing what is the reason behind this kind of particular skin condition which is happening in their body. So we should find it out whether it is coming from the food or any kind of external aganduja reasons or something like that. And this cannot be traced out even with a single sitting. So don't worry about that. Whenever the patient is coming for the next visit, again, you should try to find out more nidanas from the patient. Then some Prapti framing should be done. Then you should decide whether this is Shamana or Sodhana. Then Pathyanda Patyas is very strictly, it should be followed. And don't forget about the Abunarbhava Chikitsa. Now, coming to how to select medicines. See, we have seen a lot of medicines. Already, Madam has explained how she has selected the medicines. So obviously, dosha analysis is the most simplest way of selecting the medicines, because we have concluded, or the Acharya has concluded all sorts of symptoms into 3 levels: Vada, Pitta, and Kapha. And we all know the basics of Vada, Pitta, and Kapha, and you can easily understood from the basic slokas from the Sutrasthana. Then, apart from that, you should examine the Koshta. Why? Because here the main Dushti is Pitta or Rekta. So there should be a proper anilomana should be there. So if the Koshta is very much krura, or if the bowel activities are are compromised in a particular patient, that should be corrected first. Otherwise, what will happen means whatever medicines we are giving, it will be of no use. So remember about the koshta, again about the agni. The medicines which we are giving should be digested first, then only it will going to act inside of the body. So don't forget that. Then ama is a very, very important thing. See, when we tell about the ama, this particular ama is for the skin disease. So how we can assess the ama? Obviously the exudation, the wounds or pus, all these are suggestive to the ama. So wherever ama is there, never ever think about the snigdha applications over there or the lebana type of applications over there. We should go for the amaharatva or kapha pitta hara treatment, or shoshaga treatment should be done even externally as well as internally. So kshalana, as madam has already discussed, kshalana is a very good medicine in such conditions. Then don't forget about the role of manas, because as we all know, in the case of psoriasis or any skin diseases, if the mind is not perfect, or if it is in a down state, then it should be uplifted. There are a lot of methodologies available in Ayurveda, or like yoga therapies or counseling, whatever it be. The patient should be confident, and the patient should know that this particular disease will pass away from us with the help of these kind of medicines. Then, as I discussed earlier, Visha is a very important factor in the case of skin diseases, especially in the case of this particular Ritu. So this is a sample set of medicines. If you are confused with how, what is a sample medicine for Kabhaharatha or Pittaharatha or Vada Vittaharatha, if you are having some confusions, then these are some choices. As I told earlier, this will be giving to you as a short note, so don't worry about that if I am a little bit fast. Then there is an importance for selecting the kalpanas as well. So everybody knows it, but you should rethink, or you should remember while doing your last prescription. That's why I have put a slide like this. So always select Ruksha drugs wherever there is ama. Always select Snigdha drugs wherever there is Rukshatva. So that's why we are having preparations like Tiktaka Kashaya and Tiktaka Grida. Mahatiktaka Kashaya, Mahatiktaka Grida. Vajraga Kashaya, Vajraga. Likewise, we are having a lot of preparations in the form of different kalpanas. So make use of it while treating the skin diseases. Now hardly it will 5 minutes. Within 5 minutes it is going to finish. There are some special medicines which are available for Vaidyaratnam, and first one is a Brigat Dandapala Taila. As I told earlier, this Dandapala is a first line of choice for any kind of psoriasis wherever there is a scaling and inflammation or itching is present. This Dandapala is going to work over there. But beware, if the patient is having a sensitive skin, we cannot choose Dandapala. So don't worry. The only thing you need to change in this prescription will be the Dandapala. So immediately switch over to the other Kera Daila, that is Gobatmajadi Kera. It is prepared with these medicines, Durva, Swarasa, and as I told earlier, Venda Velichan. The virgin coconut oil is using for the preparation of this particular Kera Daila. The next one is Neeli Taila. This is coming from the Luda Visha. So you will get a Vishagina property also in this particular medicine in Neeli Taila. Then next is Parandyadi Kera Taila. Again, it's a wonderful drug which is coming from the Prayoga Samchetsa traditional textbook, which is mentioned. This medicine is mentioned for Mandali Vishahara. It is giving for Mandali Vishahara Vrana. Okay, usually whenever Vrana is coming, we are hesitated to choose Snigdha Prayogas, but this is a wonderful drug which can be given for Vrana as well. So don't worry about such situations. If there is a chances of Vrana in the case which you are dealing with, Pandyadi will be a good choice. But you should check about the Patra Bhaga, Tutta, Karpura, etc. So it's a bit, Ruksha or potent drug. This one, Parandyadi, Kerala. So while selecting the Tailas, most Mrudu is Gobatmajadi, then Neeli Tailam, then Parandyadi, then Vitpala. In such a scaling can be considered while selecting this kind of Tailas. Next is Aragoda Mahatikta Grida. We have already mentioned about this. It is using for Kabhavittahara Kushtas or Sitma, or this is having more Kabhaharata and Malanaloma and Klaidaharata because of the presence of the Aragoda along with the Mahatikta Grida. Okay, so this can be used as a Shodhana Snegabana as well as a Shamana Snegabana as per the condition. Then Aragodamrdadi Kashaya, the Kashaya which we have seen in the first slide, it consists of only 4 drugs: Aragoda, Guduji, Haridagi, and Kadira. This is a very wonderful drug. With even with the combination of Aragoda, Mrdadi Kashaya, and Dushi Vishara will be working for mild cases with no doubt. Then comes the Dushi Vishari Gudiga. The Anubana will be honey. It can be given as a 2 BD or 1 TDS, depending upon the situation, with a combination of Haridra Ganda or suitable Kashaya. So the I mean, whenever we tell about the Dushi Visha treatments, the medicine, I mean, after proper Shodhana, the only medicine which has been prescribed by the Acharya is Dushi Vishari Gudiga. So after Shodhana, you must consider Dushi Vishari Agada along with the honey in such conditions for a Rasayana. Then moving to the Darunaga, the madam has beautifully explained how you should manage the Darunaga. What I am going to mention is to how to select the Thailas for Darunaga in these situations. We have got a very wonderful drugs. Asana Eladi Kera, it's coming from a Kerala Vaidya tradition Chikilsa. So Vaidyaratnam is having 3 types of Asana Eladi, like Asana Eladi Kera, Asana Eladi Thaila, and Asana Eladi Yamaga. So as you know, it as it moves forward, the snigdhatva will be more. So wherever you need more snigdhatva, you can use the Yamaga, and wherever it is less, you can go for Asaneladi Kera. So also there you can use the Durvadi Kera Daila. Then if it is in the case of children, Chembaratyadi or Dinesha Valyadi, it is because it is mentioning in the traditional textbooks for Bala Chikilsa. So it doesn't mean that it is not usable. It is not able to. It will not give results for the adults. Obviously, it will give results for the adults. Even if you are having a itching is there along with the Darunaga, then Chambarityadi is giving a very wonderful results. Then Durdura Patradi is there. Madam has already mentioned about Durdura Patradi, but here also we should scale, or we should give an order while selecting the medicines. Again, here also this Dandapala is effective for the Darunaga or dandruff. It will be the most Dishna drug. Okay. Then comes the Durdura Patradi, lesser one. Likewise, this order will go on. So while prescribing this kind of medicines, this thing should be in your mind that don't use this kind of Tikshna drugs for prolonged days or prolonged months. Okay, so whenever this Ruksha, this kind of Tikshna is enough, when you are noticing that, just remove that and replace it with the milder Kerathilas. Then along with that, we are having Mulgadi Churna for washing the head, as well as Nimbadi Churna. Especially in the case of if there is an itching, you can wash the head with the help of Nimbadi Churna. Then other medicines like Maha Tikta Leva is there. We have already told that Maha Tikta Grida can be given externally also. Wherever there is a lack of moisture content is there in the body, you can use Mahatikta Grida, which is preparing for internal, but it can be used externally also. But in Vaidyaratnam, we are preparing it as an ointment, so it's easy to apply over the body. Mahatikta Grida Leva. Then Robani cream is there, that is Gandaga present drug. So this is a good choice for fungal infections wherever it is required. Then Flora Fair is very good for, it is based upon the Nalpamaradi, and it is very rejuvenating drug, which will produce, bring back the normal texture of the body. Hyperkeratosis, like after those, and the hyperpigmentation will be relieved with the help of Flora Fair cream. Then Shadadauda Grida is a very, very wonderful drug. I have already explained that. Jivandyadi Yagamaga in the case of Vibadiga. Okay, then this is a very important medicine, or we cannot forget about this particular medicine because it's a highly rejuvenative in the case of cracked foot. And then Villuadi Gudiga and Aragoda Asava is a drug which has been prepared with including the Aragoda Gana, as well as it consists of China power. Madhusnuki is included in the Aragoda Asam. So at the same time, you will get a Rovana effect in the case of Aragoda Asava, and also the add-on effect of the Aragodadi Gana Kashaya. So a takeaway message, if we can say with this presentation, is importance of hydration. Okay, this is lack of hydration is the reason for the skin diseases in this particular Ritu. So Snigdhatva is a very must, but don't think that Snigdhatva is only required for externally. It's required for internally also. So never ever hesitate to prescribe Gridas. as a part of internal medications. Then anti-allergic, which means Vishakana drugs should be present in your prescription. The Ritu Shodhana, especially in the case of chronic cases, because in such conditions it is not easy to cure completely. It will be probably yapia. So what you have to suggest for the patient means before reaching this particular Ritu, you should advise a patient for Ritu Shodhana at least once in a year. So what will happen means these conditions will not reappear. Okay, or even if it is going to reappear, it will be in a milder form. Then seasonal patyas and apatyas should be followed. It's beautifully explained in our Ritucharya. Then always think about the basic Ayurvedic principles while planning your treatment. So finally, even though we have discussed a lot of diseases, a lot of medicines, don't get confused. Be confident, because one or another way, all these medicines are going to work out. If you are getting an anubhashaya, just change the medicines. You will immediately get the results whenever you are changing the medicines to the right one. Okay. So thank you for your patient listening. I think now we will move on to the question answer session. So if you are having any doubts, whether it is towards me or towards to the madam, it can be sent to the chat box. We will go through all questions or all queries, and we'll try to answer every questions. So please use the chat box for the doubt clearing. Madam, can you hear?
No. Right.
Madam, can you hear?
Anybody asking the questions?
Yes. The viewers cannot ask directly, so they will
Okay.
give them questions in the question answer session. I mean the
Uh-huh.
chat box. So I will read it out. Okay,
Okay.
Madam. First one is, what is the scientific name of Pada?
Cyclia peltata. Sisambulus pereira, two varieties are there. Actually, we are using that Cyclia peltata.
Another one is, ma'am, if we have dandruff, so how much time we should oil our hair? Can we do it regularly, and with which oil?
Yeah, we can use, but I don't know. You should surely find out whether it should be diagnosed, whether it's Darunaka or seborrheic or scalp psoriasis. Then I think the doctor has told many oil, like Chambartiadi you can use. If it is more dry, you can go for Elati. And so a little more hard, you can choose Chambartiadi and Durvadi Gera and Durdura Patradi. But see, and this how the lesions are present, according to that you can select, and should not use like Durdwari Patradi for more than 10 to 15 days, because it's more ushna, it's a maybe cause some sort of hair fall also. So before 10 minutes of before bath you can apply and you can wash it off. And you can use this dried sort of amalaki is available, no, you can soak this amalaki in this rice water for 6 to 7 hours, and after that take off and make it a paste and you can apply for head wash.
Yes, madam. And if you can add a little more, if you should advise the patient to apply the oil to the scalp itself, don't to the hair, because the treatment is needed to the scalp. So don't forget about that. Okay, otherwise the patient will use on the hair.
Yes.
And another question is, ma'am, please explain Chikitsa for tinea versicolor and melasma.
Oh, Jania, I saw the same thing. How we are approaching a fungal infection, the way you can use, if more chronic internal medication is needed, first you can go for the Krimihara Aushadis like Nargundia, Krimikna, etc. After that, Kabapittahara and liver protective drugs like Padora, Ganam, etc. you can use. And externally, as I told, Siddhartha Snana Churnam or like Nimba Haridradi Churnam, you can external application, and or Tangana Churna along with buttermilk or Nimbu Surasa you can apply. And I think after that, Ropani, an ointment for Vaidyaratnam, you can use that for prevention. And for the melasma, actually, it is a another big topic. Actually, melasma, It is tell Venga, it is told in Shudraroga Prakarana, Vada Pitta is a dosha predominant for that, and the pathology behind that is a very big one. And mostly we can see any hormonal imbalance, you can see this Venga, like in menopausal syndrome, you can see that, or during any that pregnancy, this hypercholasma or melasma, you can see. So anyway, the main the drug should have the Vada Pitta Hara line, like you have choose, especially like Drakshari Gashayam, Sharibadhyasavam, or Shariba, that milk kshirapaka also you can use. So whatever the things, you have to reduce the heat in your body. Vada Pitta Hara line of treatment. Externally, you can Rakta Chandranati Churnam is available, and this I think like one cream doctor has told it's available, and so many anything like else you can use Eshtimadu, like Eshti Churna. You just make cook it with the milk and you can use external application.
Okay, madam. Thank you. And next question is regarding the Daiva Basra Chikitsa.
Okay, when regarding on the Kushta, anyway, there is a big chance, there is a big role in the case of in Deva Vyapashraya, because it's telling Papa, Ninda to Brahmana, Ninda to God, and it is telling that Purva Janmardam Karmam, Kushta Rubena, Vyati Rubena, it is telling. So there is a chance of like a role of Deva Vyapashraya, and we are also some like we are offering some psoriasis patient, they are going to, if they are worshipping Nagadeva, they are going for that. And also one, I think in Kerala, one temple is that we are using that like ഏതാത് നമ്മുടെ ഛർദിപ്പിക്കുന്ന എറണാകുളത്ത് like Kaivisha Parihara yogas, that we are using that for making out the toxicity from the body. I think there is a big role, because always the manas is getting affected when a stress, when a disease, a kushta, even a small acne in our body can cause some sort of stress. So when a kushta, when a disease, skin disease affecting the whole body, totally the patient mind will be affected. So he needs some manashanti. So any sort of prarthana, any sort of meditation, any sort of prayer he can offer. There's a role in Deva Vyapashraya.
Yes. But if I can add, this is
Yes,
a
yes,
Deva Basraya is a final choice. First
yes.
choice is always it should be the Yukti Basraya. And even if we are prescribing the right medicines, but it is not getting the results properly, then we should think about Deva Basrayas, and don't hesitate for that also. And while doing the Deva Basraya, as per their own community, as per their own religion, they can do whatever things they can do. Then, madam, next question is about the nail disease and their management.
Yeah, it's again a big topic. That's so many nail changes you can see, like some fungal infection on ecomycosis. And in the case of the psoriasis, there will be flattened, there will be splitting, and there should be linear hemorrhage, there should be oil drop changes. So many are there. If you are focusing on a fungal infection, you can do, if the nail bed is affected, like Shobhara line of, you can use Tribhala Churna externally on the nail bed. Tribala Kashayak Shanana you can use. And when the Shobha subsides, you can use Gugulu Marechadi Thailam so as to prevent the recurrence. You can use externally. I think the 4 Vaidyaratnam is available. And some Vilwadi Gulika or Kartavata like Marmaleva, etc., to remove the that nail bed Shobha. And if it is more affected with pus, Ajari is telling go for Rektavasegam. You can do Jaluka also.
Okay, ma'am. Next question is any research-oriented antifungal Ayurveda drug?
Yeah, so many researchers are there. Like I think this we can use what I can say, Siddhartha's Dhanachuna. There is a so a good study, and there is Konnela Kadakadi Lepa. It's a study is there. Tangana Nimbusurasa study is there. And I think for Rovanius also they had already done studies on this. There and all Nimbaharidradi, Nimbabatradi, everything there is a there's a
Gandhara,
researches. And
Gandhara
even
is there.
though that Abhirajada Churna, Dhuba Churna we are using for Dhubana, the same thing you can use for the Shalaya purpose. Because that is also having a very good antifungal activity. You can use for the Kshalana.
Madam, next question is when Shodhana is good for Darunaga?
When the dosha dushti is prabhuda, that I told na, when the dosha is more affected, dosha dushti is more. If the patient is so balavan, you can go for the Shodhana. If the chronic case, you should adopt Shodhana. Avipatti Nityavirechana you can give, Tribhala Churna Nityavirechana you can give.
And Murda, importance of Murda Daila is also there, isn't it, madam?
Yes, yes, of course. Kan Vadagaba is the dosha. You should avoid that and should apply oil.
Then next is use of Nishottamadi Kashayam.
Nishottamadi Kashayam, Vadagabaharam. You can use in the later stage of the, not in the first stage, in the later stage in the chronicity. After first stage, Kapapittahara line, second stage, Vadagabhara, that time you can go for Nishottamadi.
Okay. Questions are coming a lot. So next is explain Chikitsa for lichen planus.
Same sort of it's a big treatment. Which dosha dushti is more, you should go for Shodhana. After Shodhana, the same. First, if nothing, only the thickened patch, the Vada Kabahara line of treatment like Vajrana Kashayam, Panchatiktam Kashayam, etc. you can use. Externally, for removing the lichenification, you can use Eladigana Churnam along with coconut milk, or you can use marma guliga along with Bhaladi Chuna for the external application in rice water. Gives tremendous result to removing the keratinization. And after that, you can use Nilidhaladikeram or this Eladikeram to remove the pigmentation.
Then next question is in respiratory manifestations as an anti-allergic, can we give Vishakna drugs or should we go for immunomodulators?
Whatever the things we are giving
Mainly in children.
Yes, yes, because an allergy is there should be a toxicity in the body. So the Vishahara Aushadhi is having a good role in preventing the recurrence. So we can use that. And also the Vishahara Aushadhi is what we are giving, in turn it acting as an immunomodulating effect.
Next question is for dandruff, oil or shampoo.
Shampoo again causes dryness of the body. So you can go for the Kshalana as I told. After that, you can go for the oil application, and instead of shampoo, any like herbal preparations you can use, or like any chunas for the washing. Shampoos again causes that irritation, skin dryness.
And madam has already explained whether there is any more foam is there, isn't it? More foam is there, it is more.
Again, Dukshana.
Yes, even though it is herbal, it will produce issues. Then next is in Kushta during Vishrama Kala, can we apply labas?
When the doshas takes place in the tok, that time only lepa is advisable. So after proper shodhana, when shamanas takes doshas located in the tok, this after all losing conditions, then only go for the lepas.
Yes, and the concept of using oil as leba is for rasayana. It will produce immunity to the body, isn't it, madam?
Yes, yes.
Then having patients dermatitis in buttock region with more itching. I had tried with the kashayas, but itching not reducing. What to do?
That will be more fungal infection. So you should give internal medications and the personal hygiene. You should advise the patient. And if that area more always there will be some moisture. So keep the area always dry, and he can wash the dress, and he should that rinse and dry, or he has to iron it, because the fungal spore will be there. So if it is not going properly, again the recurrence will be there. So internal medication, externally antifungal treatment, what we have explained here, you can give.
And we should educate the patient also, isn't it, madam, regarding
Yes.
the what is the
Personal
cause of
hygiene.
this particular disease. Because personal hygiene is very, very relevant in such conditions. Then how we can treat pollen allergy? Pollen allergy caused skin rashes.
Same Nidana Parivajana, what the Acharyas is telling to us, any disease we should do the Nidana. If you know that pollen is allergy, you should avoid that. And some immunomodulatory effect, like you can use any immune enhancing drugs like Indugantam Kashayam, you can use Haridra Kandam, you can use Vilvadi Guliya, but the main thing you should avoid the pollens.
Okay, if the question is regarding the immediate management of pollen allergy, if I don't know what the doctor has intended. Anyhow, if that is the cause, that was the confusion, then you can go for Padola Keragridam. I have already explained that Padola Keragridam of Vaidyaratnam is very good medicine to subside this kind of immediate immediately causing allergies. Then usually kushta is contraindicated for svedana. Then how it is recommendable to go for shashtika dhanyamla dhara? Madam, please explain.
Dhanyamla is not much recommended. Actually, for the Dhanyamla causes the Kleda Haratva. Actually, for that only we are using in the case of a particular Kushta which more associate with the Kaphavitta Dushti. That's we are using in Shudra Kushta like Alasaga only. And the case of Svedana, Shastika Svedana, actually we are giving as a Rasayana here after when the all the doshas is getting elevated, we are that we did the Shodhana, we did the Shamana, we at last we have to make the patient more comfortable out there, that Rasayanas we are giving Shastika.
Then how much time Nimbarka Gugulu takes to cure Vrana?
Nimbarka Gugulu.
Yes.
Nimbarka Gugulu.
Nimbarka Gugulu. I'm not familiarized
I'm also not
with this
familiar
drug.
with
I'm
that.
not used to this drug.
Yes, yes.
Sorry, doctor. Sorry, he has corrected it as Nimbadi. Nimbadi Gugulu.
Nimbadi Gugulu.
But still,
Still
it's
not
not
available in
available in
South
the
India, I
market.
think,
Nimbadi
in
Gugulu.
Kerala. Maybe
Maybe
Nimba Gashayam, maybe Nimbadi Gashayam, it is telling that that pulare like along with the Gugulu, if we are taking it Nimbadi Gashayam for pulare kudichale. So
yes, yes,
maybe
yes.
Nimba Gashayam added with this Gugulu. It's telling that the hey kudutta guru veeraru maaranal in 6 days we will get the result. If may not be get, you should use at least for 2 weeks.
Yes, yes. For antifungal. For antifungal or whenever you are typing, please type completely because we are getting the messages one by one. That's why. Butterfly-like mark in vaginal area also with itching.
Maybe fungal infection or vaginitis infection. Like such cases, Lodhravasam gives good result, and externally, Nirgundi Patra Kashaya Dhara or Avagaham gives good result. Tribhala Kashaya Dhara you can give, but don't go for any sort of oil or pichu something. Only Avagaha or Kshalana and anti-fungal treatment internally. And if she having any leukorrhea, like any white discharge, first you should treat that like Kapapita Hara line of treatment like Mushri Gadradi, etc. you can give.
How to treat bandaging dermatitis?
Eh?
Bandaging dermatitis.
That's again maybe because of that's we are giving that bandage compression, maybe contact dermatitis. You do the Kshalana, that's enough.
Yes, yes. So always think about. I mean, even we are getting some experience like after the treatments of, I mean, usual treatment like takradara, or after that we may get some sort of fungal infections. Why? Because the same path is using for all the patients, isn't it? So there are chances for this kind of infections where Shalana will give easily, I mean, good results. Within 1 or 2 days itself, you will get the result. What can be advised for strawberry skin due to adverse cosmetics?
Like same thing, Rajari has told in Shushruta Kalpasana, like Mukhaleba Visha, Mukha become Shava, Patmani Kandagara, Pidaga will be there, and there will be sort of a Shavada. Same thing, you can use the Kshalana with Tripaladi Kashayam added with HT Churna. Do that, nothing else. Internally, Guduchadi Kashayam you can give along with the Vilvadi Gudiga. Avipatti Virechana also you can prescribe.
Okay. Next question. When pimples and dryness both is there, what is the line of treatment?
When pimples see there, Kabhavada, it's a dosha predominant. You can use Kshalana with Tribhaladi Kashayam internally. Like internally, you can go with Nimbadi Kashayam added with Kaishwara Gugulu plus honey, Avipatti Virejana, and do the Kshalana when Tribhala added with HT. HT is little sniktha, but it should not increases more pimples also. And after that, you can use Lothadi Churnam externally. And else, our Acharya is telling like that coconut shell. You can make a decoction with coconut shell and you can wash that the face.
Yes. And you can examine the pimples whether it is pustular or normal pimple, isn't it?
Yes.
If it is not pustular, or if it is pustular, definitely you should consider the Kavitahara treatment. Otherwise,
Yeah.
there are some Kerala are also available, which can cure the pimples also. I mean, the pidagas also, if it is a
Some sort of
normal pidaka.
yes,
Yes.
some sort of hormonal imbalance also can cause such cases. So just find out for the PCOS and all.
Uh, uh, I listened about few cases of ear infection of aspergillus, and it also affected some area of nasal bone and ear, and it was treated with allopathic medicine. But then it again recurred after 3 to 4 months. So, which Ayurvedic medicine we should use for such infection like aspergillus?
This aspergillus, no, when it comes first, we are using the earbuds. While using that, again, the spore will go inside, and it will reach the internal ear. So maybe while the external, like modern medicine, they will suck the things. Otherwise, if we are using again the earbuds or something cleansing, it should increases the fungal. And internally, for preventing the recurrence, you can use the Google. First, Patyakshadatradi like Kashayas. After that, you can choose the Google.
Okay, okay. We are receiving a lot of questions, but unfortunately, we are having time up to 9 o'clock. It's only 1 minute more, so don't worry about that. We will check all the questions, and we will give the answers for those questions along with the notes which we are providing to all the participants. I hope it will be sufficient. Okay, so thank you, madam, for a wonderful session with us, and thank you, the team Vaidyaratnam, for giving us opportunity for this particular webinar series. So I think I hand over to Dr. Srijit.
Yeah, thank you, sir. Thank you very much. Thank you, Madam and sir, for your wonderful session. And thank you, everyone, for your patient listening. Okay. And as sir told, we will address all the queries, and we will attach these things with the attachment, and we'll provide you very soon. First of all, I would like to thank Professor Sanjeev Sharma, Vice Chancellor, National Institute of Ayurveda, Jaipur, on behalf of Vaidyaratnam Aushadashala, for inaugurating this session. We are aware that about your busy schedule, sir. So thank you very much, sir. And on behalf of Vaidyaratnam Aushadashala, I would like to express my sincere thanks to Dr. Ashwati for your enlightening and informative session. Thank you very much, madam. And also, I would like to thank Dr. Aravind sir for moderating this session. It was a thoroughly enlightening and informative session for the listeners. Thank you very much, sir. I know there was some technical issues had happened during the session. Uh, thank you everyone for cooperating with us. Uh, in this session, more than 1,200 participants were present. So thank you everyone for making this webinar into a grand success. As I already told our our vision and mission are to promote a classical Ayurveda. So the next session, I told this is a webinar series actually. So the next session will be on respiratory diseases. The date and time will be shared soon. Uh, so thank you everyone. And the e-certificate and the PDF protocols about this session will reach you within 4 to 5 days. So once again, thank you everyone, and good night. Good night all. Thank
Thank
you.
you.
Thank you, thank you.
Okay, I'm so sorry for the that inconvenience that was from my part. Some technical issues. I'm
It's
so
okay,
sorry.
man. It's okay. The technical issues will be there sometimes, right? It's okay.
Okay.
Thank you, man. Thank you very much. Thank you, sir. Thank you, everyone.
Thank you.
Good night.
Good night.